Dr. Hayworth, Congressman Hall, good evening. I would like to begin our discussion with health care. The Federal Health Care Reform Act is very complex, and the impacts, of course, are still unknown. Most people agree the goal to insure more Americans is a noble one, but there are concerns, of course, about how this is going to work, and more importantly, who is going to foot the trillion-dollar bill. President Obama and other supporters of the bill have touted it as a job creator, and that likely is the case in the healthcare sector. But there are concerns that in the rush to pass a bill, this could actually hurt the job market. For example, the bill's play-to-pay provision requires businesses with more than 50 full-time workers to provide insurance or pay an annual fee. Mr. Hall, you supported the bill, so I would ask you, by enforcing mandated coverage, are you concerned that employees may be less likely to hire to keep them under that 50 mark?
Thank you, Karen, for the question. And I would say, first of all, 95.5% of all businesses in New York are below the 50 full-time employee mark and therefore have no mandate at all. But they do have help from the government under this bill. If they choose to provide health care, this year 35% of that cost would be subsidized under the bill, and in 2 years 50% of the cost. So it actually is an opportunity for small businesses to help their employees should they choose to. It also provides the opportunity for all citizens and all small businesses to go into an exchange similar to the one that I have as a member of Congress, where you can negotiate with the power of millions of people rather than, say, a business of 50 or 10 or 5 or 15 people trying to negotiate with a big insurance company. And lastly, I would say something that's not been pointed out by any media that I've seen, which is that our congressional health care, whichever one of us is sitting in this seat, every member of the Senate and the House will give up their health care plan. It's taken away from them under this bill in 2014 when the exchange is fully up and running, and we must, all members of Congress must buy their insurance from the exchange. So in other words, we're leading with our own family's health and safety, and therefore if there's a problem with this bill, I will bet that it'll get fixed.
Excuse me, Mr. Hall, though. There are businesses out there that say they want to hire. We're coming out of a recession. They're beefing up for more business, but that's a concern that they don't. Someone that may have 48 or 49 employees may not want to hire those extra employees because that would put them
Thank you. I was hearing the same thing before we voted on health care, that businesses were getting 39.5% increases in 1 year, and please do something. I mean, we held roundtables with the Business Association, with the Dutchess County Chamber, with the Orange County Chambers of Commerce. The number one complaint we heard before we passed the health care bill from the small businesses that make up those chambers was the yearly unsustainable increases in health care premiums. So, if the bill has not kicked in yet, so we don't know yet what the full effects of it will be, but the previous system was, I believe, unsustainable for our small businesses and for our country as a whole.
Okay, thank you, sir. Dr. Hayworth, if elected, you will work to repeal this Health Care Reform Act, correct?
I will.
And what would you propose as a way to lower health insurance costs across the board?
We need to control costs by actually putting those decisions in the hands of American consumers. We need to empower consumers to make better decisions by enshrining the health savings account as the standard means by which people finance their health care. And indeed, that's part of the short bill that Republicans have been advocating for. And a good example of how it has succeeded, how that kind of mechanism has succeeded, is in the state of Indiana for their Healthy Indiana program. Mitch Daniels is the governor there. And about 4 years ago, he instituted a program by which their Medicaid patients received vouchers. State employees received the ability to put pre-tax dollars in health savings accounts. They purchased catastrophic insurance plans to cover for eventualities that were highly expensive, and they pay for routine care out of their pre-tax dollars. Routine care, medications, diagnostics, examinations, all of those expenses. And what has been found is that over 4 years, probably now going on 5, is that the employees who have that program have saved tens of millions of dollars. The state as employer has saved tens of millions of dollars. It's really the only kind of mechanism that's been proven to work when we know what we're paying and when we can judge whether or not it's appropriate to pay those expenses. We actually can, as consumers, control the cost without a governmental mechanism stepping in and depriving us of choice and quality.
Thank you.
I'd like to stay on the subject of health care, and Dr. Hayworth, I'll start with you. As mentioned, obviously you're a doctor and you know the medical industry very well, but You also have a financial stake in your district. Your husband's the CEO of the Mount Kisco Medical Group. Dr. Scott Hayworth, I read a posting by him recently. He said they are the largest provider of medical services in the Hudson Valley, providing services to more than 250,000 patients of all ages, with more than 210 doctors employed. The projections from the nonpartisan group say this health care plan that got passed will, on average in your district, have about 35,000 people that currently don't have health care. It would provide it for them. Having such a major voice and stake and control in the health care of so many people in your district, why wouldn't you celebrate more than anyone the idea that 35,000 more of your constituents, men, women, children, could now get health care?
I do celebrate that idea. I think it's a wonderful idea. I think that's what we should all be aiming for and working toward. That my quibble or objection is not with that at all. It is with the mechanism by which we are endeavoring to achieve this. The new health law will not achieve what we need it to do. It will vastly increase the cost of our health care.
But one thing we do know, with all due respect, is more than 50 million Americans currently don't have health insurance. This, although imperfect it may be, everyone agrees will substantially reduce by tens of millions those that are currently uninsured. How would your plan reduce that number by 50, 60, 70%, depending on the numbers you hear?
In a very troubling way, unfortunately, this bill, while it confers trillions of dollars of cost, new cost, on the American public, actually leaves an estimated at least 21 million Americans not insured. So this bill actually will not accomplish what it is intended to do. But in fact, it's been shown that we can provide a much greater opportunity for, say, the citizens of the state of New York, and there's been some very good academic work out of the University of Minnesota through the Manhattan Institute, actually, so it's homegrown in a sense, indicating that we can increase access to insurance, affordable portable insurance, dramatically by 41% in some cases, by instituting health savings accounts, by allowing purchase of insurance across state lines, another key element of this plan, by controlling liability, which the new health law did not touch at all, and by providing for high-risk pools within the state so that no one who has a pre-existing condition or a special need can be without insurance.